to CPC. So I think, Peter, you gave a seminar here back in the summer of 2019 when we were all in person and we were actually sitting in the maths tower.
Yes.
And talking about microsimulation modeling. And it's a real delight to welcome you back to CPC, but be it virtually, although you're just down the road, about 15 miles away. And going to be talking about COVID in New Zealand, which is a fascinating. We've all been following COVID, following New Zealand throughout the pandemic. Being very jealous of you at some stages when we were all locked up at home and we were all out watching rugby matches and drinking beer.
That's right.
We're probably not so jealous of you right now.
No, that's right. That's right.
So the floor is yours, Peter.
Yeah, good. Well, thank you very much for giving me this opportunity. I just actually happened to be visiting the UK, but some distance from Southampton. And I've been an Emeritus Professor for a couple of years, and that gives you a bit of time to kind of do things you don't have to do under pressure, and take time out and think about it a bit. And along came COVID, and then having been in the medical school in a sort of a public health background, and actually I was an elected member of the district health board. I was sort of moved to kind of join the debate about what was happening around us. And so what the talk today is I put together three contributions I made to different outlets at different stages of the time in New Zealand, sort of just to document it and share my thoughts such as they were and look back at it. And this is just basically, you could call it a case study. We're a small liberal democracy trying to work our way through what is essentially an existential crisis in many respects without a plan. This is a kind of a sort of a resume of it, so to speak. So what I'm going to do then is I'm going to draw on different sources. The first one is a graph showing how, even though the New Zealand story is in many ways a very optimistic and good one, actually the public opinion has shifted. They were with the government through all the difficult times. And then once we got to just before Omicron, the winds of change started to occur, and people started to think about, could life be different? Do we really have to have all these restrictions, etc.? So there was been a dramatic shift in the polls. Secondly, I'm going to draw on a publication I did for Social Europe, which is a social democratic paper. Back in December of last year, basically saying the good story, what was the successful aspects of New Zealand approach. And of course, we had a lot of things going for us. We're in Ireland, where it's a smaller population. It's easier to get consensus. There isn't a huge political spectrum to cross. And there were other examples, the Asian examples. We had Singapore, we had Taiwan, we had Korea, we had Australia. So there were and China, number of examples of countries that sort of went for what was called elimination strategy. Then I'll draw on a paper I shared with the British Sociological Association, because when Delta hit New Zealand, we'd been almost untouched by the pandemic. We'd had lockdowns, but only 50 people had died over practically 2 years. And everyone was basically living a normal life in many respects, apart from the fact they couldn't travel out of the country, or at least be sure of getting back. But along came Delta, which was harder to control. And me as a sociologist, it was striking how this got through our barriers and showed up. It was sort of a stress test of our society and of our systems, and it showed up a whole lot of deficiencies which up to that point we had not been aware of. And I'd also been through the HIV/AIDS epidemic, and a similar thing had happened then, where we suddenly saw groups that had been marginal or overlooked coming out, and we were realizing that they were vulnerable. And so this same thing happened with this infectious disease. It sort of brought these to the surface. And the final piece is something I wrote for a paper as the government was dropping its protections and restrictions, partly because Omicron was supposed to be milder, partly because of public reactions at that point, the shift in public mood. And I wrote this sort of thoughtful piece, so to speak, thinking, can we embed new forms of protective behavior? For example, wearing masks in public transport. My wife and I are traveling around, and when we're on trains and in the airports and all the rest of it, and then in shops, we're wearing masks, but hardly anybody else is. So is this an aberration, or is this something we should really be considering? And finally, some conclusions. So that's the sort of the skeleton of it. First of all, the graph. So what we have here is the from what we got January 21 through to about now. You can see the number of seats. We have a proportional representation system in New Zealand, 120. And back in January 21, the Labour and the Greens would have had 75 seats, and National and ACT, which is on the right, would have had 45. And then you can see, judging from the polls, how the thing has narrowed to this point where if we had an election now, the Conservatives or the right of centre would probably win with a good chance of winning. So there's been this quite dramatic shift just in the space of a few months of people saying, look, we're over this. We want to travel. We kind of we're not sure, you know, where we're going with this. Can we sort of start to lead a less restrictive life, etc., etc. So the government has sort of lost some of the sort of trust and confidence that it had held for almost 2 years. So that just show you how quickly things can change and have changed in New Zealand. What it means in the future, I'm not too sure, but I just give that as a background, that what I'm telling you is really New Zealand up to that point, and then a little bit New Zealand after the point, and sort of kind of the shifting sands of the pandemic. Oops, sorry. So the first thing I'm going to look at is just to say that we up to late 2021, we were thinking we'd won the war. We had 50 deaths. We had an improvement in life expectancy. Most countries had a reduction. The economy performed well, partly because of wage and business, but partly because 80% was untouched. It's our export industries. The borders were closed, and internally life was mainly normal. But there is a policy agenda which the government hasn't been able to tackle, what you might call the peace dividend. You know, tackling poverty, homelessness, reforming health and education, industry resets, climate change, infrastructure investment, relationships with the Maori, who are the indigenous people who make up 15% of the population. So we've got a government that has supposedly won the war up to late 2021, and all of a sudden it now realizes it's got a real policy agenda, but it's not quite sure whether it has the mandate, the time, the political capital that it can actually implement, given how much time was spent on COVID. So that's really the conundrum that the government's facing. So the first paper I wrote was in Social Europe, where I was sort of bullish about the New Zealand story, so to speak. The Virus Antidote, they gave it as the title, and trying to get at the ingredients. What was the secret to the New Zealand success pre-Omicron? And that's a picture of our Prime Minister, Jacinda Ardern, and really a lot actually came down to her leadership and way of sort of rising to the challenge of this sort of unprecedented crisis. So in Social Europe, basically I outlined how we adopted what's called an elimination strategy, which most countries really couldn't even imagine achieving. They had huge lockdowns. We quickly controlled borders. We had active suppression. We had testing and tracing, and we managed to essentially keep out the original virus. until Delta came along, which was August 2021. And the government returned with a full majority in late 2020, which under a proportional representation system is almost impossible. And the last time anything like that happened was in the Depression in the 1930s, when the Labour government got again a full majority under first past the post. So it showed that the public was behind the government. They were absolutely on side about controlling the borders, active suppression, testing and tracing, and then they enjoyed the fruits of it, which was basically 2 Christmases as normal, or all sorts of outdoor activities. Then August 2021, we had a Delta outbreak because we opened the bubble with Australia and somebody came across the Tasman. And Delta was a completely new case. It broke through our barriers. It got into disadvantaged and vulnerable communities in a way that the first incursion of the virus did not. The first incursion of the virus was returning New Zealanders, returning from the world as borders closed. They were mainly middle class, European of origin, Pākehā. It didn't get into the vulnerable communities and we eliminated it. Delta was different. It got into all sorts of nooks and crannies in New Zealand society and it just got a lot harder to deal with. So we introduced a modified elimination strategy, vaccine plus. We managed to get high vaccination rates late in the piece. By December of last year, we were up 95%. We also had vaccination mandates and passes. And at the time, this seemed uncontroversial, but in due course, this produced a political and social reaction, which I'll get onto. What were the ingredients of that initial success? Well, basically, like almost all other countries, we didn't have a functional strategy. We had influenza, we had virus strategies, we hadn't experienced the earlier coronavirus outbreaks, which other countries had. Maybe like, I think maybe Taiwan had, so they had experience of this. So we were flying blind, as was the rest of the world. But the political and bureaucratic leadership rose to the occasion. There was consensus. We had almost certainly weekly television audiences with the Prime Minister and the Director General of Health, with all the media in front of them, asking every conceivable question, often in quite a hostile manner, which actually the public got a bit upset about. But actually, I thought that it was fair enough. They've got to be able to answer these questions. And some of them were a little bit tedious, but they rose to the occasion. And so that was, so the leadership and the public debate sort of, and in a country of 5 million, it was perhaps easier. It was brought together. A lot of this was transparent and open. Health was prioritized. And in a way, there was a big debate about that. But in the end, we realized that actually, once we'd hammered the early virus, we didn't need repeated surges and lockdowns. And in fact, it was actually a brilliant insight that if you managed to contain the virus, you could, in many respects, have a normal economic and social functioning, which until Omicron, until Delta came along, was how it was. It was very self-consciously science-based. The public supported this. The public kind of took this on board. And there were times when you could see that increasingly political priorities were also playing a part. For example, we asked all our border workers to be vaccinated when there was enough vaccine at the beginning. And then we discovered that a certain proportion had not got vaccinated, and really the government was searching for a social license to do these things. It really wasn't quite sure where public opinion was, how far ahead of public opinion it could get in insisting on vaccination for everyone working at the border. That was the first mandate. They were taken to court. We had all sorts of legal challenges on every aspect, including the quarantine facilities. Everything was litigated, and there were Bill of Rights that said that you were not allowed to restrict New Zealanders from returning to New Zealand. And so, you know, what was this thing with this quarantine? So all these things were worked through in what you'd hope would be a sort of quite a mature an adult fashion that you would hope would be possible in a country of our kind, with a legal system, the open media. All these things, in my view, showed our kind of system of government to its best, frankly. And I've actually become more of a proponent of the liberal democratic model of governance in a way as a result of this. Populism did not arise until later on. So those were the ingredients of our initial success, and I use the word initial because really it lasted a good 18 months. We had 2 clear Christmases, we had holidays. In fact, we were able to enjoy holidays in New Zealand, which we couldn't otherwise have done, because my wife and I walked the Milford Track. Well, normally you can't do that because it's always booked up for overseas tourists, but there were none. So 2 industries, overseas tourism and international students, basically were paused. But I don't know that many international tourists would have come anyway, because who was traveling at the height of the coronavirus? Anyway, so those were the initial ingredients of success, and that was, I published that in December, and I was still quite bullish about the New Zealand model, and indeed I still am, but it actually turned shortly after that. So the next stage of my thinking was when I put this paper up for a British Sociological Association, and it was striking how the Delta outbreak broke through our system. It exposed all sorts of vulnerabilities in our system and our society, which up till that point had not been put to the test because we had a border around us, and Delta came in and broke through that. So I harked back to the HIV/AIDS epidemic of the 1980s, where I was a sort of sociologist who'd been at the medical school for a few years, and been told that infectious diseases were passé, and essentially what we're dealing with nowadays is non-communicable diseases, apart from a few things like tuberculosis, meningococcal, rheumatic fever, a few things which actually we have more of than we should, but they were seen as affecting subgroups. So the thing I went through when I did the HIV/AIDS epidemic, and I went through that with colleagues, what it did was, again, as a sociologist or as a citizen, it brought to light certain key groups who otherwise had been, you might say, on the margins. Men who have sex with men, sex workers, injecting drug users. These were not part of daily discourse and discussion, and all of a sudden they were brought to the fore and reminded us that they actually existed, and they were particularly susceptible in these areas, in the area of the HIV/AIDS. As a sociologist, all of a sudden there was funding available to do surveys and things in these areas, which otherwise had been seen as a little bit peripheral. And I only mention that as a side thing, but actually it just showed you how all of a sudden the disease, the way it opened up vistas on our society and vulnerabilities, and showed how in a way we had legal systems. For example, homosexual acts between men were illegal till the mid-80s. Sex workers were semi-illegal until the 2000s. Injecting drug users is still a grey area. So, and we did adopt, and one of the main people who've contributed a lot to the New Zealand model is a guy called Michael Baker, who was a medical student of mine, funnily enough, when I was teaching at the medical school. And he went through with the HIV/AIDS epidemic, and that was his important learning experience, where he was a medical advisor. And we adopted a partnership approach where we worked with the affected groups rather than on them. We worked through community organisations. So instead of the Ministry of Health doing everything, we had a thing called the New Zealand AIDS Foundation. This is not peculiar to New Zealand. I know in the UK and elsewhere similar things happen. And again, that was an organisation run by gay men for the gay community, publicly funded. Similarly, there was a prostitutes collective, again, organising the sex workers in such a way that they could be advocating on their behalf. And we had changes in the law. So in the 1980s, the law was changed on consensual acts between men, and there was a change in the in the 2000s on sex work, which basically legalized it under certain circumstances. So this was an experience. And then when along came coronavirus, this guy Michael Baker all of a sudden came back into his own again. You know, it sort of seen as being a bit peripheral in the infectious diseases, and this learning experience we'd had was brought back to us, which was very striking. With the COVID pandemic, with Delta, it really opened our eyes in a way that the way in which we avoided the initial impact of coronavirus had not. In particular, we suddenly found we had to worry about how well managed institutions were for elderly people, and the fact that our ministry people, the equivalent to the ministry people, didn't have the powers that they needed to enter them and ask them to change and to improve their infection control. This was a revelation. We also discovered people called essential workers. These were working class people who drove trucks to the supermarkets and so on. They had to go through, they had to pass tests and things in a way that we suddenly realized, just like the healthcare workers, these people were essential. Normally they're at the bottom of the pecking order, but there they were. It brought for the Maori and Pacifica people, disadvantaged migrants were badly affected when Delta came along. And they lived in multi-generational households. They often lived in streets where people mixed. They weren't in tidy little nuclear households. It was much harder to manage the pandemic, partly because they were not close to the health system, and partly because of their lifestyles and ways of interacting, and their distrust to some degree of the system made it harder. Mental health, we found that there were people with various lifestyle and other health issues who didn't behave like normal patients, and it was hard to find the proper outreach mechanism to get to them. Substance abuse was an issue because you had people who were drug addicts, and you really couldn't assume that they would, and particularly because very often they were in the criminal underworld, there was an issue about how to reach out to them. This was similar to the HIV/AIDS, actually, where you had groups that were actually semi-illegal. So as I say, we had sex workers in the criminal underworld where people were breaking through the boundaries for lockdowns in order to deliver drugs. And so we actually had to work with the gangs and with the, and for example, I was on the board where somebody who'd been in hospital, self-discharged, to go back to their home despite being unwell with COVID, and eventually died after everyone tried to advise them not to. And the issue was the person was a methamphetamine addict, and they were getting withdrawal symptoms. So they weren't behaving rationally. So it took us some time to kind of then adjust to that and find other ways of dealing with groups who otherwise were not the classic standard patient. And also we discovered widespread infrastructure and system shortcomings. For example, we found that we didn't have a population register, which is pretty shocking, an accurate one. We found that about 10% of the people in the Auckland region that we vaccinated actually were not on our records. There were, prior to this government, there'd been a Conservative government post GFC, which had been kind of tightening things, and I think more than tightening. And so infrastructure like immunization registers and things like that were actually close to collapse. And we had a whole lot of restructuring and infrastructure rebuilding, billions of dollars spent, which was a real close call. So yeah, so for me as a sociologist, you know, I'd been through the HIV/AIDS thing, and all of a sudden, you know, this was a real world problem that people wanted to talk to sociologists about, because it wasn't just a medical issue. It was about behavior. It was about social groups in the community and who were on the margin, so to speak. And that brought the strength of my discipline to bear. And then with COVID, a similar thing happened once Delta broke through. All of a sudden, these groups started to emerge. We found, for example, in Auckland, there were 800 transitional housing units with very often people there who were not, very often these places were not registered. Their occupants were not named and registered. And yet these people we had to track down because that's where this thing was spreading. So this was a revelation that nobody actually knew. We just thought we had a few backpackers hostels, but actually there was a heck of a lot more going on. And a lot of it's to do with homelessness, etc. So these were revelations to the system that showed that the society, frankly, was relying a little bit on historical strengths, and all of a sudden we realized they weren't there, and these were being tested. Okay, finally, something that's post-Omicron, or well, I should say post-Delta and during Omicron, is there a new normal? And in the photograph there, you can see a bus driver, and he's actually wearing a mask. So I use public transport, and I found that very often all the passengers are masked, but as often as not, the driver is not. So, you know, what kind of message is that? And everyone's crammed in these buses with 20, 30 people, and, you know, it just takes one infected person to pass it on. So we got to the point that the public mood had shifted. There was militancy, anti-vaccination, anti-mandates. There was COVID fatigue, and that was really showed itself with an occupation of the parliamentary grounds. There was a lot of conspiracy theorizing, a lot of borrowed information from international networks, particularly from the United States. It was sort of like a sort of just kind of slightly changed. Hang on, I'm just going to put my power on. So that you know, we kind of, certain groups just borrowed wholesale videos, conspiracy theories. The police weren't quite sure how to deal with this. They didn't want to evict them and create a whole lot of martyrs, so they allowed them to even set up their own toilets. They had their own cooking facilities. And eventually they did move in and ship them, but this was a turning point in many respects. The public weren't with them, but the public realized in a way that things had got a bit, well, I don't know, they felt a bit uneasy, and the mood was shifting, and there was a growing COVID fatigue among the public. In New Zealand, international New Zealanders were taking the government to court about the quarantine system, so that was going to the court. So the whole lot of counter things were occurring, and the government was really a bit on the defensive. So what's happened post, I shouldn't say post Omicron, now what I mean is Omicron is actually, right now, it's doing its work right through the New Zealand population. We're behind you, and we're going into winter. So we're experiencing something that you would have had to deal with some months ago. And at the same time, the government's progressively dismantling controls. Some vaccine mandates have been lifted. Masking is largely optional. And yet at the same time, the number of deaths we've had has increased from 50. We only had 50, which was, you know, 10 per million, which is about 1% of the UK death toll. It's now expanded 20-fold and more in a space of a few months, and we're getting reports each week. We're having as many deaths each week now as we had in 2 years. So something has changed. I can't put my finger on it exactly. Omicron is a harder thing. It's getting through. It's particularly affecting older people. And at the same time, the government's a bit on the back foot, has reduced some restrictions and the like. And I'm not sure how this is all going to play out, but we certainly won't be having a death rate at the end of it that is as low as we had for the first 2 years. So, I mean, one of the issues then is, do we kind of give up on precautionary behavior, like vaccination passes and mask mandates? And I'll just give you a couple examples from the university. So we were talking about the university. University went online, like, most others did, for the first couple of years. And we're now students coming back to the campus. So one of the issues was we used to have vaccination passes in order to get onto the campus, and the university authorities lifted that. And I asked a colleague of mine who knows about these things, I said, isn't that a bit of a danger? And he said, look, it probably won't make a difference one way or the other. It won't actually reduce the risk. It won't actually increase the risk. And I said, well, as a social scientist, really, can you switch behavior on and off in this fashion, just according to epidemiological considerations? There's also a behavioral one, is that we actually want people to still continue what we thought were good patterns of behavior, like just flashing your vaccine pass to make sure when you come onto the campus that you're up to date. Similarly with the masking, you see, I travel on public transport, and I asked a bus driver why wasn't he wearing a mask, which is sort of a bit of a bold thing to do. Could be seen as a bit rude, but he said, oh, I've got a mask mandate. And I said, on what grounds? And he wouldn't tell me. So the truth is that people are just less worried about it. People have got used to the idea of the deaths being reported, 50 a week. In the past, when we had a single death, the Director General of Health would give his condolences to the family. Well, now we got 50 a week, while previously we had 50 in 2 years. So it's something that our sort of society is going to have to deal with. How do we deal with what coronavirus is going to continue to come our way? Okay, just some concluding remarks. So by luck and good management, we enjoyed one of the best pre-Omicron pandemics. Our economy held up. Our life expectancy improved, basically. We had good health outcomes, and most things, apart from a couple of industries which were badly affected, continued as normal, apart from international travel. But the pandemic was a stress test for the welfare state and revealed many shortcomings that we either had been sort of were socially invisible or just not politically salient. The transient housing was one. The drug trade was another. The distance of certain social groups like Maori and Pacifica from the health system was another. The fact we didn't have a proper population register or immunization register for that matter were another couple of things. So these things came out of it, which frankly should never have happened. We should know about and we should be dealing with all the time. But it was salutary to be aware of that. The social consensus around the elimination and immediately post-elimination has since frayed. People are much more casual. People still in the supermarkets, the majority will still be masked, and on the buses. But and a lot of people want to get an extra dose. But apart from that, people are just accepting this in a way almost like a flu thing, despite these number of deaths being reported. And people are ambivalent; they're not quite sure. They were very clear before, and now not too clear. And I think the scientific evidence is also, not how far can you go with asking people to retain these restrictions on behaviour. So there's more of COVID still to come. Future pandemics, liberal democracy in New Zealand, we responded well, but actually it has its weaknesses. The public can shift. They can decide they don't want to do things you ask them to do. They have legal recourse. They have rights that they can exercise. They can take time to be convinced of the science. And there's conflicting with social media, that's conflicting, quote, science. There's a lot of anti-science. It's quite a trick in countries of our kind to craft a response, particularly in somewhere like the UK, which is much larger, more diverse. New Zealand is very diverse, but it's smaller and more face-to-face, and it's possibly easier to sort of forge a consensus, but it might be more difficult. So that's a conundrum for, excuse me, for liberal democracies in the future. Is coronavirus is not over. There will be new ones. Will we be better prepared? Not just with vaccination, but with the whole panoply of behavioural and other interventions that actually really do make a difference over and above vaccine on its own. So I'll leave it there and open up for questions, and I'm sure that Jane will exert a strong ruling hand.